Hello everybody. Today we will discuss about sound tissue interactions, which refer to the ways in which ultrasound waves interact with the tissues of the body as they propagate through them. These interactions play a crucial role in determining the quality and clarity of ultrasound images. Absorption refers to the process where ultrasound energy is converted into heat energy while passing through a medium, such as tissue or bone. This means that some of the ultrasound energy is absorbed by the medium and transformed into heat. Remember, among all other factors responsible for attenuation, which means weakening in strength of sound waves, absorption is the most dominant form. This means that absorption plays a significant role in reducing the intensity of the ultrasound beam as it penetrates deeper into the body. Absorption is directly related to frequency. Higher frequency ultrasound waves are absorbed more readily than lower frequency waves. This means that as the frequency of ultrasound increases, so does the amount of absorption. Also, rate absorption depends on the medium through which it is passing. Like sound traveling in bone undergoes extensive absorption as compared to sound passing through liquid, limiting their penetration into bone tissue. Before knowing what is reflection, we should understand what is an interface. Interface is a boundary between two tissues. When a sound wave strikes a boundary, two things can happen. Either all of the sound wave is reflected back, or a part is reflected and part is transmitted into next medium. This depends on angle of incidence and surface of the boundary that we will study in next couple of slides. When sound waves encounter a boundary between two different materials or tissues in the body, some of the waves bounce back, that is reflected, while the rest continue or transmitted into the new material. So reflection means a portion of the sound waves that comes back towards the source. This reflected energy carries valuable information and contributes to the formation of an image. It helps in visualizing the boundaries and surfaces of organs and tissues. When ultrasound waves meet a boundary between two tissues, they can reflect in two different ways: specular reflection and diffuse reflection, that we will study one by one. In specular reflection, ultrasound waves hit a large, smooth, flat boundary between the two tissues, like a mirror-like surface. Instead of bouncing off randomly, nearly all sound bounce back in a neat, predictable, and organized manner, only in one direction following the law of reflection. This organized bouncing creates a clear and well-defined echo, often producing sharp and distinct boundaries between tissues on the ultrasound image, making it easier to see structures inside the body, example diaphragm, pericardium, etc. Diffuse reflection happens when ultrasound waves hit an irregular or rough boundary between tissues. Instead of bouncing off in a straight line, they scatter in various directions. This type of reflection creates a scattered, less focused echo. It's like the light spreading out unevenly. When you shine a flashlight on a rocky surface, the angle of incidence is an angle at which the sound wave hits the boundary. Angle of incidence determines the angle at which sound wave is reflected. So, in simple terms, an angle of incidence that is perpendicular to a smooth specular interface results in more return of the reflected sound waves to the transducer and create a more hyperechoic or brighter image. An incident wave hitting the interface at an angle that is not perpendicular will result in less return of the reflected sound waves. The signal of the returning echo is weakened, creating a more hypoechoic, darker image. Understanding these two types of reflection and angle of incidence helps us make sense of the different echoes we see in ultrasound images. Specular reflection gives us clear, crisp boundaries between tissues, while diffuse reflection contributes to the overall texture and appearance of tissues on the ultrasound image. Law of reflection. According to this law, angle of incidence, that is the angle at which the waves strike the boundary, is equal to the angle of reflection, that is the angle at which the waves bounce off. Scattering happens when ultrasound waves encounter a boundary of a structure, which is not only irregular, but smaller than the wavelength. In such case, the waves get bounced randomly in many different directions carrying small energy, and therefore produces weak echoes. Scattering is responsible for it, producing a unique pattern to the tissue, or normal parenchyma or any pathology. Scattering reflectors are backbone of ultrasound images. Scattering is directly related frequency. Rayleigh scattering is a special form of scattering that occurs when the structure's dimensions are much smaller than the beam's wavelength. In clinical imaging, typical example is interaction of ultrasound and red blood cells results in Rayleigh scattering. Rayleigh scattering redirects the sound wave equally in all directions. Rayleigh scattering increases dramatically with increasing frequency. Mathematically, Rayleigh scattering is related to frequency raised to the fourth power.